Hello. Thank you for the questions that I've received. Do we start taking our health seriously after the age of 30? The answer is no. So, following the guidelines here in the USA for the women, we're supposed to do cervical cancer screening from the age of 21. So when you're 21 to 29, they want us to do a pap smear to where they check for cervical cells that are like precancerous, and then you follow up with an OBGYN and get it treated every 3 years. After the age of 30, you do 30 to 65, you do the code testing. So the cytology and an HPV test if you want to, and that's going to be every 5 years or closer together if they find any abnormalities. For colorectal cancer screening, it is recommended to start at the age of 45. However, if you have a family member that had colon cancer, you had anybody that a first degree relative, or there's cancer in the family in general, you might have to get screened earlier. Breast cancer screening is recommended from the age of 50 for women. But then again, if you have a first degree relative, a mother, grandmother, aunt that had breast cancer, died from breast cancer or any kind of cancer, you might get screened sooner, right? We also have the screening for hypertension. The US Task Force, Preventative Task Force wants us to do it after the age of 18, literally for everybody, every adult after the age of 18, at least once a year in a primary care physician's office. And also for type 2 diabetes, the task force recommends that you start screening at the age of 35 if there are predisposing conditions like obesity and high cholesterol. Hey, we're all bigger now, we're a little fatter. So I would say, depending on your family history, family background, you can start getting screened sooner if you have predisposing conditions. I will do a video on diabetes, what to look out for, the subtle signs that could tell you're diabetic. That's a video that's coming up. And for osteoporosis, it's not very common with us, the melanated people, like the Africans, I'd say, because I guess our bones are stronger. However, it is recommended to get screened, the DEXA scan for the bones, bone density, after the age of 65 or sooner if you have a first degree relative that had osteoporosis. I can't think of any other questions that I had. So take home message is, go to the doctor. Doesn't matter if you have to be, if you had a family member that's sick or that died from something, just to get your health into your hands. Again, if you have any questions, I'm open to questions. I'm always available to provide answers. Listen to your primary care provider. Whatever they recommend you do it. And also read, right? Just go online, Google anything you're curious about. Don't trust Google, however. Try to make sure that if you have a question about something, if you're not feeling well, check with your primary care provider before you start diagnosing yourself with things and treating yourself for things, okay? All right, thank you.